start with another references Vrana Gatra Vichurnane, Vranayati iti Vrana. These all means Vrana is one which covers or involves a large surface area, and once the Vrana is happening, that is even if it is healed, the Vrana Vastu, that is the Vrana Chinna, will not be cleared. That is, the person have to carry it for his life. And Vrana is that which causes damage or destruction to the tissues. So that is the Nirukti or Paribhasha of Vrana. Next is the Bheda. So Dvau Vrano Bhavatah Sharira Akantuscha Tayo Sharira Pavanapitta Kapha Shonita Sannipata Nimitta Aganturapi पुरुष पशु पक्षी व्याल सरीसृप प्रपतन पीडन प्रहर अग्निक्षार विष तीक्ष्ण औषध शकल कपाल शृंग चक्रेषु परशु शक्ति कुन्दाद्यायुधाभिघात निमित्त तत्र तुल्ये व्रणसामान्ये द्विकारणोत्थान प्रयोजन सामर्थ्यात् द्विव्रणीय इत्युच्यते. That is, based on the cause, there are two types it is told. One is Sharira and another one is Akantuja. Sharira or Nija Vrana are the Vrana which is caused in the body secondary to the Visheshan of Vata, Pitta, Kapha and Rakta or their combinations. And Agantu, as you know, it is caused by any other acquired factors. Like it can be a trauma caused due to any animals or with any objects. If the Vrana is caused, then it comes under Agantuja Vrana. Because of these two types of based on the causes, it is of two types and hence it is given the name Dvivraniya. Then it is told about the features. Means when the clinical features are told, it can be divided into Samanya and Vishesha. Samanya, it is told Tatra Samanyam Ruk. That is, pain is the common feature in all types of Vrana. And when it comes to Vishesha Lakshana, it depends on the dosha involved. And based on the dosha involved, the features are told like तत्र श्याव अरुणाभस्तनु शीतपिच्छिलो अल्पस्रावी रूक्ष चडचटायनशीलः स्फुरण आयाम तोदभेद वेदना बहुलो नर्मांसश्चेति वातात्. That is the one which is caused due to the visheshan of vata. In that, blackish or reddish brown discoloration will be there. The discharge from that, it will be thin, cold, sticky and less, and it will be dry and cracked in the surface. It will cause twitching, stretching or different kinds of pain will be present, and there will be loss of tissue. And then next, that is about the Vadaja Vrana. When it comes to Pitta, it is told Kshipraja Pita Nilabha Kimshukodagabha Ushnasravi Daha Pakaraga Vikarakari Pita Pidaga Jushtaschedi Pitta. That is, it will be occurring quickly. The discoloration will be yellowish or blue in color. Discharge will resemble that of Kimshukodaga. It will be Ushna. It will cause burning sensations, suppuration, redness, etc. And there will be yellowish boils covered over the surface of the Vrana. Then about Kapha, it is told प्रदत चंड कंडु बहुला स्थूलौष्ट स्तब्ध शिरास्नायु जालावतत कठिन पांडु अवभासो मंद वेदना शुक्ल शीत सांद्र पिच्छिलास्रावी गुरुश्चेति कफात. That is mainly there will be continuous itching. The edges will be thick. It will be covered by thick vessels or thick veins and ligaments will be present. It will be indurated. That the hardness will be present. Color, it will be pale, and the discharge also, it will be pale, cold, viscous and sticky, and pain will be mild. Then it is about Rakta, and it is told Pravaladala Nijaya Prakasha Krishna Spota Pidaga Jala Upajita Turangasthana Gandhi Svedano Savedano Dhumayana Shilo Rakta Sravi Pitta Lingaschedi Rakta. That is, when it is associated with Rakta Visheshan, the color will resemble that of the Pittaja Prana, and the wound will appear like a collection of pravala, that is pieces of coral, and it will be covered by blackish boils or blisters. And the smell, it is told like Turangasthana Gandhi, that is hose stable. That will be foul smell will be present, and the wound will be painful. It will bleed easily, and the other features associated with Pittaja Vrana, that also will be present in Raktaja type of Vrana. Then it is told about combinations like Vata Pitta, Vata Shleshma, Pitta Shleshma. Like that, the Samsarga and Sannipata is told. In Vata Pittabhyam, it is told Todadaha धूमायन प्राय पीत अरुणाभ तद्वर्णस्रावी चेति वातपित्ताभ्याम. Pricking pain, burning sensation, patient feels like fumes are emitting out of the vrana, then discharge will be yellowish or reddish in color. Then Kanduyana Sheila Sanistodo Ruksho Guru Dharuno Muhur Muhur Shida Pichila Alpa Sravi Cheti Vata Shleshmapyam. When it is associated with Vata and Shleshma, there will be predominance of itching, but also pricking pain will be there. So it will be rough, hard, and heavy. Its induration will be present, and the discharge will be continuous, cold, slimy, but it will be scanty. And then in Pitta Shleshmabhyam it is told Guru Sadaha Ushna Pita Pandustravi Cheti Pitta Shleshmabhyam. When it is associated with Pitta and Kapha, there will be burning sensation, heaviness will be there, it will be hot, discharge will be yellowish or pale in color. Next, Rukshasthanustoda Sutta Ivacha Rakta Arunabhastadvarnasravi Cheti Vatashonitapya. In Vatashonitaja, the ulcer will be rough, it will be thin, there will be numbness and pricking pain present, and discharge will be reddish in color. Kritamandabho Meenadhavana Toya Gandhi Mrudu Visarpi Ushna Krishna Sravi Cheti Pitta Shonitabhyam. And in Pitta Shonitaja Vrana, the site will appear like Kritamanda, a geese pump, and the odor will be like the water used for washing fish. That odor will be present, it will be soft, and Visarpeti means that it will be spreading in nature, and the discharge is hot and black in color. Then Rakto Guru Snigdha Pichila Kandu Praya Stiro Sarakta Pandu Shravi Chedi Shleshma Shonitapya. When it is associated with Kapha and Shonita, the site will appear red, it will be heavy, the shiny, smooth, immobile, and there will be itching sensation. The discharge will be mixed with red color. Spurana Toda Daha Dhumayana Praya Pita Tanu Rakta Sravi Cheti Vata Pitta Shonitepya. When Vata, Pitta and Shonita are involved together, the patient feels like a pulsating sensation, pricking pain will be there, burning or fuming sensation will be there, and the discharge will be thin, yellowish, and mixed with blood. Kandu Spurana Chumuchumayamana Praya Pandu Khana Rakta Sravi Cheti Vata Shleshma Shonitepya. When Vata, Kapha and Shonita is involved, there will be itching, pulsations will be present, tingling sensation will be present, and the discharge will be thick, pale, and mixed with blood. Daha Paga Raga Kandu Praya Pandu Khana Rakta Sravi Chedi Pitta Shreshma Shonitepya. When Pitta, Kapha and Shonita are involved, there will be burning sensation, separation, redness, itching, and discharge will be thick, pale, and blood will be present. Trividha Varna Vedana Srava Visheshopeta Pavana Pitta Kafebhya. When Vata, Pitta, Kapha are involved, then different kinds of pain will be there, different kinds of discharges will be there, and the discoloration also will be of different colors. Based on the involvement of all the three doshas, the features will be present. Nardahana Narmadhana Spurana Toda Daha Paka Raga Kandu Swapa Bahulo Nana Varna Vedana Srava Visheshopeta Pavana Pitta Kapha Shonitepya. When all the four factors are involved, then there will be a presentation which is having features similar to or features pertaining to all the three doshas and rakta. So that are the Vishesha Lakshanas for Vrana based on the dosha and based on the involvement of rakta as such. Next it is told about Shuddha Vrana. So what is Shuddha Vrana? Jihva talabho mrudu snigdha shlakshno vigada vedana suvyavasthido nirasravascheti Shuddho Vrana iti. That is the wound which is clean wound. How it will be? Shuddha Vrana is told the floor of the ulcer will be pink, like the color of a clean tongue. It will be soft, unctuous, smooth. There will not be any previous symptoms. Means whatever symptom were present, that will not be present at that stage. It will be well formed and it will be free from excessive discharge. And another reference for Shuddha Vrana it is told, Tribir Doshe Ranakranta Shava Ushtapidagi Sama, Avedano Nirasravo Vrana Shuddha Hochete. That is, uh, the Shuddha Vrana, it is a condition where there is no visheshan of the three doshas. That is, Tribir Doshe Ranakranta, it is not afflicted by the visheshtat doshas. Shava Ushtapidagi Sama, that is, the margin should be Shava, it means blackish or bluish color that shows about the presence of granulation, healthy tissues coming up. Then there will be small pidiga, that is sprouts of granulation tissue. And avedana nirasravo vrana shiddhai hochide, there will not be any pain, there will not be any discharge. These are the features of Shuddha Vrana or a clean wound. Then it is told about Ruhyamana Vrana, that is Ruhyamana means the one which is in the healing process, a healing wound. That is Kapota Varna Pratima Yasyanta Kleda Varjita Sthirashchipitika Vanto Rohatiti Tamadishe. That is, the color will be grayish or something similar to the color of a pigeon. Then Kapota Varna Pratima Yasyanta Kleda Varjita. That is, there will not be any excessive moisture. Sthirashchipitika Vanto Rohatiti Tamadishe. That is, that will be stira, firm, and there will be peeling of skin in the surrounding area. That is a healing ulcer or Ruhyamana Vrana. And next it is about Rudha Vrana. Rudha Vrana, Rudhavatmanam Agranthir, Ashunam Arujam Vranam, Taksavarnam Samatalam, Samyak Rudham Vinadvishe. Rudha Vrana means one which is healed. So how the healed wound will be? It is told, Rudhavatmanam Agranthim, there will not be any induration or swelling. Ashuna, there will not be any edema. Aruja, pain will not be there. Vaksavarnam. Vaksavarnam means it will be having the same color as that of the surrounding skin. Samatalam, the level of the ulcer area, that will be same level as that of the surrounding area. That features, if it is presented, then it is to be considered as a Rudha Vrana or healed wound. Next it is about Dushta Vrana. Dushta Vrana, it is Dushta, means it is vitiated or it is infected condition. So how a Dushta Vrana will be? Tatra ati samrito, ati vivrito, ati katino, ati mrudurutsano, avasanno, ati shito, atyushna, krishnarakta pita, shukladina varnana, manyitama varna, bhairavaha, puti puyam mamsa sirasnayu prabrtivihi purna, puti puya sravi, unmargi, utsangi, amanojna darshana gantha, अत्यर्थम वेदनावान दाह पाक राग कंडु शोफ पिडगोपद्रुत अत्यर्थम दुष्ट शोणित स्रावी दीर्घकालानुबंधी चेति दुष्ट व्रण लिंगाय. So the features of dushta vrana, when the ulcers are not properly taken care of, or when it is not treated at the proper time, what happens? It will be getting vitiated in an excessive form, or it gets infected due to the severe vitiated doshas. So how the prana will be in that case? It is told ati samrita or ati vivrita. It can be having a very narrow opening. Means the opening will be very narrow, or it can be a very wide ulcer. Then ati katina or ati mridu. It can be very hard or very soft or fragile. Utsanna or avasanna. It can be a raised ulcer or it can be a depressed one. Ati shita or atyushna. Very cold or very hot. Bhairavaha. Bhairavaha means it will be having a frightful appearance. So that is Bhairavaha. That much vitiation or that much infected it will be. Puti Puya Mamsa Siras Snayu Prabrtivihi Puna. It will be filled with decayed tissue like Mamsa Siras Snayu or pus etc. will be filled inside. And Puti Puya Srava. Discharge. That will be foul discharge. Unmargi, Utsangi. Unmargi means can be having deep cracks. Due to the infection, it might have already developed cracks inside. Then Utsangi, raised dead tissue will be there. Amanojna Darshana Gandha. It will be in Darshana and Gandha to see, and as well as the smell. It will be ugly to see and it will be having bad odor. Atyartha Vedana, there will be severe pain. Daha Paga Raga Kandu Shofa Pidagobadruda. It will be associated with burning sensation, suppuration, redness, itching, and boils. Atyartha dushta shonita srava, excessively vitiated blood will be flowing out. Then dirgha kala anubandhi, the origin or the onset will be of chronic condition. So when these features are present, it's not like every feature will be present, but some of the other features will be present in case of a dushta vrana. Another classification is given by Acharya Charaka about the types of prana. Like in the 25th chapter, Charaka Chikitsa 25th chapter, it is told, Kritya utkritya stada dushto adushto marmastito nacha samruto daruna sravi savisho vishamastita utsangi utsanna eshamcha vranan vidyat viparyayat iti nanato bhedena nirukta vimshatir vrana. So the types of vrana according to Acharya Charaka is Kritya utkritya दुष्टा अदुष्टा मर्मस्थिता न मर्मस्थिता सनिवृता उद्विवृता दारुणा मृदु श्रावी अश्रावी सविष निर्विष समा विषमा उत्संगी अनुत्संगी sanna and anutsanna. So 20 types are told by Acharya Charaka. Another classification. Then it is told Shanmoola Ashtaparigrahi Panjalakshana Lakshita Shashtya Vidhanir Nirdishte Chaturthi Sadhide Vrana. That is Shanmoola. Vrana should be examined based on the Shanmoola, means which are the causes. Shanmoola means the 6 root causes, which include Vata, Pitta, Kapha, Rakta, Sannipataja and Agantuja. Then Ashtaparigrahi. Ashtaparigrahi, the Adhisthana of Prana, Tvak, Mamsa, Sira, Snayu, Sandhi, Asti, Koshta and Marma. These are the 8 sides or 8 Adhishthanas of Prana. Then Pancha Lakshana Rakshita, that is same thing, whether it is Ekadoshaja, Dvandaja, Sannipataja, Raktaja or Kshataja, that have to be examined. And also Pancha Lakshana Lakshita includes the Gandha, Varna, Srava, Vedana and Akriti also. So based on this, the examination of Prana have to be done, and then Shashtya Vidhanir Nirdishte Chadurbhi Sadhide Vrana. Then using the Shashti Rupakrama, it can be managed by the 60 measures, which is told under the heading of Shashti Rupakrama, and with the help of the Nirdishte Chadurbhi means the Chatushpada, Vishakdravya Upastada. So that have to be made use of, and thus the Vrana can be treated. That is, while treating a Vrana, first all these factors, Shanmoola, Ashtaparigrahi and the Panchalakshana Lakshita, the 5 Lakshanas based on the cause, as well as the Gandha, Varna, Srava, Vedana and Akriti have to be considered, and with the help of the 4 means Chatushpadas, and by using the Shashti Rupakrama, the Vrana can be managed. Then which are the Ashtaparigrahi, it is told, which are the Pranavastu or Ashtaparigrahi means, Parigrahi is also means the Adhisthana. So where the Vrana is having the Adhishthanas. So it is 8 in number, the Pranavastu is 8. Tvak, Mamsa, Sira, Snayu, Asti, Sandhi, Koshta, Marmaniti, Ashto Vranavastuni. Atra Sarva Vrana Sannivisha. The 8 Adhishthanas told are Tvak, Mamsa, Sira, Snayu, Asti, Sandhi, Koshta and Marma. These are the Ashta Vranavastu told. And it is told like based on the involvement of this Pranavastu, it is told, the Sadhya Sadhyata is told like Prana involving only one location like Tvak alone is involved. Then it is told like it is Supachara, that is it is easily curable, and all the others, that is as it involves the deeper locations, the prognosis become poorer. It is told like Surupachara, it is difficult to treat. Based on the Pranavastu also, the Sadhya Sadhyata is told. Now we will see about the different features, means how the Gandha, Srava, etc. will be. So first it is about the Gandha. What and all Gandha can be presented in a Vrana. Sarpi, Taila, Vasa, Puya, Rakta Shava, Amla Pudika, Vranana, Vrana Gandha, Ashto Gandha, Pratikritida. Just told like different kinds of orders like that of Krita, Taila, Vasa, Puya, Rakta, Shava, Amla. These kind of orders can be present in the Vrana based on the doshas vitiated and based on the cause. Then about Varna it is told Bhasma Kapota Asti Varna Parishu Aruna Krishna iti Marutajasya Neelapito Harita Shava Krishno Rakta Pingala Kapila iti Rakta Pitta Samudhayo Shveda Snigdha Panduriti Shleshmajasya Sarva Varnopeta Sannipatika iti. That is the color, based on the color. If it is ash or dove colored or reddish black or black in color, then it is due to Vataja Visheshan. And if it is blue, yellow, greenish, black, reddish, black or brown or gray color, then it is due to Pitta and Rakta association. And when it is white and pale, it is due to Kapha. And when there is presence of all the three, means it is mixed color present, then it is to be understood that it is a Sanipatika Varakati. Then next it is told about the Strava, and in Strava it is first it is told based on the site, that is based on the level of involvement. So first line if you see Tatra Krishtasu Chinnasu va Tvakshu Spote Bhinne Vidarideva Salila Prakasho Bhavatyasrava Kinjit Visra Pita Avabhasascha. Tvakshu means when the skin is involved. When there is prana caused in the skin, then it will be Salila Prakasha, Kinjit Visra and Pita Avabhasa. It will be similar to water, means watery discharge will be present, and sometimes it will be having Visragandha and Pidavabhasascha, light yellowish discoloration will be present. Next it is told about Mamsakada, and Mamsakada it is told Sarpi Prakasha, it will be like Sarpi, it will be Sandra, Shweta and Pichila. When it is Siragada, it is told when trauma or massive when an injury is happening, then it will be causing massive hemorrhage. And when separation, after separation, what happens, there will be pus mixed with blood will be flowing out continuously, and then it is told it will be, means how it will be Tanu, Vichina, Pichila and Avalambi, it will be intermittent, and it will be Tanu and Pichila Strava which is present from a Siragata Prana. Then it is told about Snayu. Snayu it is told Snigdha Thana Sarakta Singanaga Pratima Strava will be coming out. Like means it will be thick discharge which is coming from a Snayugata Prana. Then Asti it is told Astigado Astanyabhigade Sputite Pinne Doshavadharite va Doshapakshidhatvat Asti Nisaram Shukti Dhautam Ivabhati. That is, Asti becomes porous, weak and broken, and it becomes whiter like washed oyster shell. Like that, the discharge will be there, and the discharge will be mixed with majja. And also there can be blood mixed discharge, and it will be snigdha. That is the strava which is coming from Astigata Prana. Then Sandhi is told, and it is told like the discharge does not appear on pressing. For Sandhi, the reference given is Sandhigata Pidyamano na pravartate. That is, when pressure is given or while pressing, the discharge will not appear. Akunchana Prasarana Unnamana Vinamana Pradhavana Utkasana Pravahaneshcha Sravadi. That is, while doing various movements, it will appear. That is told about Sandhi, and it is told Asravaschatra Pichilo Avalambi Sarudhironidascha. That is, and the discharge coming out will be Pichila Avalambi. It will be forming sticky threads, and it will be appearing like churn with blood. That is, blood mixed discharge will be coming out when the prana is present in a Sandhi. Then it is told about Koshta. That is, when Koshta Prana is present, then it is told like discharge will be Astra, Mutra, Purisha or Udaga based on the location or based on the Koshta involved. Then Marma it is told Marma Gadastu Tvagadishu Avaruddhatva no Uchyate. That is, discharge depends on the predominant dhatu in the Marma. Based on the location, the discharge will be depending on the based on the location of the Marma as such. That is the nature of discharge based on those 8 factors. Then it is told about the dosha involvement. Like in Vataja, Tatra Tvagati Gadana Masravanam Yathakramam Parushya Shava Avashyaya Dadi Mastu Ksharodaka Mamsa Dhavana Pulagodaka Sannidhatvat Sannibhatvani Marutad Bhavanti. That is due to Vata, if the discharge is caused, then the discharge will be like curd water, water of Kshara, meat washed water, or like sharp water, that it will be dry or scanty. Then that which is caused due to Pitta Visheshan, that will be Gomedaka Satrisha, it will be like cow's urine, ash, oyster shell, or then wine or oil. Then when it is caused due to Kapha, the discharge will be like butter or kasisa, majja, then flour, sesamum, coconut water, or pig's fat. It is told Varaha Vasa. So that will be the Strava when it is associated with Kapha. Then it is told Sannipadaja. Sannipadaja also it is told Sannipada, Nalikerodaka, Ervaruka, Rasa, Kanjika, Prasada, uh, Prasada, Arukodaka, Priyangu Phala, Yakrit, Mudga, Yusha, Savarnatva Niti. That is, it will be similar to the color of coconut water, cucumber juice, gruel, liver, color of liver, or soup of green gram, etc. So that will be the Strava, how the Strava will be depending upon the Pranavastu as well as the doshas. Next, it is told about Vedana. So Vedana, you know that when the dosha is associated, it is typical to that particular dosha. Herein, Todana, Hedana, Tadana, Chedana, Ayamana, ಮಂಥನ ವಿಕ್ಷೇಪಣ ಚುಮುಚುಮಾಯನ ನಿರ್ದಹನ ಅವಭಂಜನ ಸ್ಫೋಟನ ವಿದಾರಣ ಉತ್ಪಾಟನ ಕಂಪನ ವಿವಿಧ ಶೂಲ ವಿಶ್ಲೇಷಣ ವಿಕಿರಣ ಸ್ತಂಭನ ಪೂರಣ ಸ್ವಪ್ನ ಆಕುಂಚನ ಅಂಕುಶಿಕ ಸಂಭವಂತಿ ಅನಿಮಿತ್ತ ವಿವಿಧ ವೇದನಾ ಪ್ರಾದುರ್ಭಾವೋ ವಾ ಮುಹುರ್ಮುಹುರ್ ಯತ್ರ ಆಗಚ್ಚಂತಿ ವೇದನಾ ವಿಶೇಷ ಸ್ತಂಭಾದಿಕಮಿತಿ ವಿದ್ಯಾ. ದಟ್ ಇಸ್ ಡಿಫ್ರೆಂಟ್ ಕೈಂಡ್ಸ್ ಆಫ್ ಪೇನ್ ಲೈಕ್ ತೋದ ಭೇದ ತಾಡನ ಛೇದನ ಮೀನ್ಸ್ ಸ್ಟ್ರೆಚಿಂಗ್ ಸ್ಕ್ಯಾಟರಿಂಗ್ ಟೈಪ್, pulling, pricking, different kinds of pain will be present when it is associated with Vata. There is, we cannot tell, the pain can be intermittent, there is no consistency, means the timing, severity or nature of pain, there will not be any consistency, and for the aggravation and specification there will not be any reason. So such kind of pains will be present when there is Vata Visheshan, and when it is Pitta, it will be more of that burning sensation, Osha, Chosha, Paridaha, Dhumayana. Then means when applied with Kshara, how the feeling will be same will be present in Prana, which is associated with Pittaja Visheshan. And in Kapha, of course, there will be more of Kandu, Gaurava, Suktada, Alpa Vedana it will be, and Stambhana, Shaitya, these will be present in Apaja condition. Raktaja, it will be same like that of the Pittaja condition, and Sannipadaja, there will be mixed features. That is about the Vedana. Then this shloka, it is told about certain factors which cause defective or delayed healing, like Snayu Kleda, Sira Kleda, ಗಂಭೀರ್ಯ ಕೃಮಿಭಕ್ಷಣಾತ್ ಅಸ್ಥಿಭೇದಾತ್ ಶಲ್ಯತ್ವಾತ್ ಸವಿಷತ್ವಾತ್ ಸರ್ಪಣಾತ್ ನಖಕಾಷ್ಟಪ್ರಭೇದಾತ್ ಚರ್ಮಲೋಮಾದಿಘಟನಾತ್ ಬಂಧಾದತಿ ಸ್ನೇಹಾತ್ ಅತಿವೈಷಜ್ಯಕರ್ಷಣಾತ್ ಅಜೀರ್ಣಾತ್ ಅತಿಭುಕ್ತಾತ್ ವಿರುದ್ಧ ಅಸಾತ್ಮ್ಯ ಭೋಜನಾತ್ ಶೋಕಾತ್ ಕ್ರೋಧಾತ್ ದಿವಾ ಸ್ವಪ್ನಾತ್ ವ್ಯಾಯಾಮಾನ್ ಮೈಥುನಾತ್ ತದಾ ಪ್ರಾಣಾನ ಪ್ರಶಮಂ ಯಾಂತಿ ನಿಷ್ಕ್ರಿಯತ್ವಾಚ ದೇಹಿನ ಪರಿಸ್ರಾವಾಚ ಗಂಧಾಚ ದೋಷಾಚ ಉಪದ್ರವೈ ಸಹ Prananam Bahudoshanam Krichrutam Chobhayate. That is when there is increased moisture in the prana, when there is increased depth of the ulcers, when it is infested with krill or maggots is present, when there is infection or disease condition of the bones below the ulcer, and there is presence of foreign body or poison, when the ulcer is fast spreading, when the vrana breaks open due to trauma, due to metal stick or something, when the margins are rubbing against each other constantly, when hairs are present, when improper bandaging is done. So similarly, because of these types of different factors, what causes there will be defective or delayed healing of the vrana as such. And other than that, other than these kind of factors, the emotional certain emotions like excess sorrow, excess anger, these also can lead to delayed or defective healing. And other viharas like day sleep, excessive exercise, excessive sexual intercourse, these also will be acting as a factor for the delay. Then it is about the upadrava. Upadravastu vividha vranasya vranitasya cha tatra gandhadaya pancha vranasya upadrava smrita churatisaro mocha cha hika chaddirarojaka shwasakasa vipakascha trishna cha vranitasya tu. And in Charaka Samhita there is mentioning of 16 upadravas. And the upadravas it is told like it can be Vrana Upadrava, that is complication of the ulcer as such, or Vranitasya Upadrava, that is complication from the patient who is having the ulcer. So, complication of ulcer, it is told that all those Gandha, Vrana, Srava, Vedana, Akriti, all those signs which is in respect to that Vrana, Gandha, Varna, Srava, etc., that is considered as the complication. That is when there is association of different kinds of pain or when there is excess, that indicates the complication of the vrana as such. And then in case of patient it is told different kinds of diseases like fever, diarrhea, loss of consciousness, cough, vomiting, anorexia, dyspnea, indigestion, thirst. These are the complications as far as the patient is concerned. So upadrava it is told as upadrava of vrana, vrana upadrava as well as vranitasya upadrava, upadrava in the patient. Next it is about the management of vrana. So management of vrana it is mentioned under the, mainly it is mentioned under the heading Shashti Rupakrama. So these measures specify the Vrana Shofa in its initial stage. That is, before becoming Vrana, it will be a Vrana Shofa which will get separated and open up into a Vrana. So in that stage, in its initial stage, when these Shashti Rupakarmas, this will help in the specifying the Vrana Shofa and prevent the separation. And if it is in the separated stage, it will help in the drainage of pus, or it will help and help in cleansing the vrana as well as it will promote the healing. And once the healing means once the vrana is formed, and in the healing process also it will help in correct healing, that is for the cosmetic purpose, that also for the scar is formed and that formed scar will be acceptable, that is cosmetic correction is also done with the help of this Shashti Rupakrama. So the Shashti Rupakramas which is told under this heading, it will be helping in different ways. Means different procedures are told for acting on different conditions. That is in the initial stage to help in the Vrana Shofa Avastha, then in the separated stage to drain the pus, then once the Vrana is formed, it's Shodhana and Ropana, then after the scar is formed, for the cosmetic correction also, these Shashti Rupakarmas will be beneficial. And this is mentioned in the Sushruta Samhita Chikitsa Sthana first chapter. And we will see which are the Shashti Rupakramas. तस्य व्रणस्य षष्टिरुपक्रमा भवन्ति तद्यथा अपतर्पणमालेपा परिशीको अभ्यङ्गा स्वेदो विम्लापनमुपनाः पाचनं विश्रावणं स्नेहो वमनं विरेचनं छेदनं भेदनं धारणं लेखनम् एषणम् आहरणं व्यथनं विश्रावणं सीवनं सन्धानं पीडनं शोणितास्तादनं निर्वापणम् उत्कारिका कषायो वर्ति कल्प सर्पिस्तैलं रसक्रिया अवचूर्णनं रणधूपनम् उत्सादनम् अवसादनं मृदुकर्म दारुणकर्म क्षारकर्म अग्निकर्म कृष्णकर्म पाण्डुकर्म प्रतिसारणं रोमसञ्जननं रोमापहरणं बस्तिकर्म उत्तरबस्तिकर्म बन्ध पत्रदान कृमिघ्न बृंहणं विषक्नं शिरोविरेचनं नस्यं कवलधारणं धूमो मधु सर्पिर्यन्त्रमाहारो रक्षाविधानमिति. So these are the Shashti Rupakramas told by Acharya Sushruta. So in that first 11 it is told like Ekadash Upakrama, and that is beneficial for the treatment of Vrana Shofa. So first we will see about the each procedures, and the first one it is Apatarpana. So for Apatarpana it is told Apatarpanam Adya Upakrama Yesha Sarva Shofanam Samanyaha Pradhanatamscha दोषोच्छायोपशान्त्यर्थं दोषानधस्य देहिना अवेक्ष्य दोषं प्राणं च कार्यं स्यादपतर्पणम् ऊर्ध्वमारुततृष्णाक्षुत् मुखशोष श्रमान्विते न कार्यं गर्भिणी वृथा Baladurbalabhirvihi. So here it is told means what is the importance of Avatarpana as well as where it is contraindicated. These slokas tell these 2 points. First, it is told that first and important procedure it is Apatarpana. It can be adopted in all varieties of shofa. Sarva shofanam samanyaha pradhantamascha. So that is told. Then doshochaya upashandyartham doshanadhasya dehena veksha dosham pranam. That is it will specify the vitiated doshas and which have to be adopted based on the strength of the dosha as well as the patient. And then the contraindication it is told that is in persons who is having excessive belching, thirst, hunger, dryness in the mouth when the person is exhausted. In case of pregnant women, children, elderly persons, and those who are emaciated, these apatarpana is contraindicated. That is about apatarpana. And next is alepa. Alepa it is told शोफेषु उत्थितमात्रेषु व्रणेषु उग्ररुचेषु च यथा स्वैरौषधेर्लेपं प्रत्येकशेन कारयेत्. नेक्स्ट यथा प्रज्वलते वैष्मन्यम्भसा परिषेचनं क्षिप्रं प्रशमयत्यग्निम् एवम् आलेपनं द्विजः प्रह्लादने शोधने च शोकस्य हरणे तथा उत्सादने रोपणे च लेपस्यात् तदर्थः. So alepa it is useful in swelling which is of recent origin. It is useful in those associated with severe pain. Just like the water extinguishes the fire immediately as it is put over the fire, similarly when the lepa will help to reduce pain immediately. That is the simile told for the effect of alepa. In alepa it also helps in means clearing the wound as well as to promote the healing, and when it is a depressed wound, this alepa helps to make it elevated also. So that is about alepa. Then parisheka it is told vatashofetu vedanopashamartham sarpistailadhanyamla mamsarasa vatahar aushadam nishparhe rashite parishekam kurveta vittarakta abhigata vishanimitteshu ksheerakrata madhu sharkara udaka इक्षुरस मधुर औषध क्षीर वृक्ष निष्पादे धनुष्णे परिषेकान् कुर्वीत श्लेष्म शोफेतु